So I'm Cathy Moonshine, and I've been here for a couple other echoes. And today we're going to talk about lifestyle medicine. So I'm a licensed clinical psychologist, and I live and work in Hilo. I'm currently in private practice, having just left working at the family medicine residency at the hospital here. And in addition to being a clinical psychologist, I'm a certified substance abuse counselor and board certified in lifestyle medicine, which is what we're going to be talking about a lot today. And joining me is Dr. Ben Wing, who is one of our family medicine residents in Hilo, and he's going to talk a little bit about who he is and where he fits in lifestyle medicine.
Yep. So I'm a second-year resident in family medicine here at Hilo Medical Center. I had the chance to actually work with Dr. Moonshine previously, and so I was really grateful for this opportunity to present with her as well. I have kind of moved all over the place throughout my education. I did an undergraduate degree in Oahu. I did a master's in London, and then I did my medical school training in the Caribbean. With clinical training all throughout the UK and then the US. I'm now here and loving it here and planning on staying here in Hilo. That's just a little bit about me. As far as the lifestyle medicine, one of the biggest draws that I had to this program was the fact that we had the chance to be board certified in both family medicine as well as lifestyle medicine. That was something that really resonated with me and what I wanted to do, and really that kind of aim for me is in my practice and helping counsel my patients. And so that was a big draw for me, and we'll kind of talk a little bit more about that today.
All right, great. So now we're gonna go to our PowerPoint. And if you can't see that, if someone could let me know. There we go. Okay, so let's see if I can move gonna just adjust where I see the menu bar so I can see what's going on. Okay, so often we make resolutions, family members make resolutions this time of year. A lot of our clients come in, people come to therapy after absence or for the first time in January saying, oh, I really want to work on these things. We certainly see increases in gym memberships, as well as people signing up for meal planning and other things. Unfortunately, it's estimated that less than 10% of resolutions are still happening 60 to 90 days later. So we're going to talk a little bit about that and how some of the things in lifestyle medicine that we recommend and how that helps people be healthier physically and emotionally, mentally, and how we can work on making incremental changes that are sustainable over time. But I want to start with this audio clip from NPR, and it's a poem, a community source poem about resolutions. Oh, wait, hold on. I probably have to share sound, don't I? Let's go to, hold on, give me 1 second, share sound.
Rules, Rachel, are meant to be.
With the new year comes new promises and new goals, new friendships and new rules.
But some rules, Rachel, are meant to be broken.
They are, aren't they?
Yes.
Kwame Alexander is our poet in residence, and he joins me here in the studios. Hello, Kwame.
Rachel, glad to be back in D.C.
Okay, well, I am glad you are here in the flesh in the studio because we need you to help us unveil another fabulous community poem.
And this one is extra fabulous.
Extra fabulous.
So when we were last together, you said one of your resolutions was to write more poetry.
I actually didn't. I said not write, like have in my life.
Well, you just did it, so I'm holding you to that. That's my point.
All right, fine, yeah. Okay, so last time we asked you, our listeners, to send in couplets of your abandoned New Year's resolutions.
We thought it might be a light way to not take ourselves too seriously. No judgments, people.
Right. So we got over 500 creative and thought-provoking lines and poems. Then you, Kwame, did your thing. You combined some of your words into a poem of epic proportions.
Yeah, I took all of their poems and I created one of our crowdsourced community poems. But let's switch it up this week.
Okay.
These beautiful, amazing couplets all have a musical flow. They really came alive musically with rhythm and rhyme.
That makes sense. Music and poetry, one and the same.
My friend Nikki Giovanni says poetry and music are very good friends. So let's recite this month's crowdsourced community poem with a little music underneath. What do you think?
Yeah, let's do it. What do we got? All right, so here we go. All our contributors to this poem are listed on the NPR website. You should go check it out. Kwame, you start. Here we go.
Here's to my treadmill incomplete, without the sound of slapping feet. Eating healthy, getting abs, but chips and chocolate up for grabs. Oh, banana pudding from the deli, how did you get inside my belly?
I was a vegetarian all the way to 10 a.m. My goals quickly turned to apathy. At least I eat happily. People acting all highfalutin because they said they've sworn off gluten.
Why do my resolutions fail? Why can't I just eat that kale? What makes me want to poke my fork into that plate of spiced pulled pork?
Why do I shun vegan potpourri after I resolve to go fat-free? I think I shall come next New Year, vow no more pizza, no more beer. Then perhaps I might instead choose green tea and pita bread.
What did I do? Sorry.
I vow each year to lose, each time a few more from which to choose, to stop feeding my Krispy Kreme addiction, to watch less news, read more fiction.
To the running shoes gathering dust by the back door, to the unfinished dissertation I habitually ignore, to all the papers I did not grade, to all the beds I never made.
Though I promise to timely fold, laundry in the dryer lays there cold, I resolve to not procrastinate. I'll start tomorrow. Is that too late?
Junk mail towers a teetering stack. The will to sort it I clearly lack. New resume, that's what I want. Alas, can't find the perfect font.
Oh, sweet tenor ukulele, last year's holiday treasure. You filled my heart with sunshine songs in spite of ill wind weather. A year gone by on wistful sigh, no lessons and no learning. A lifetime worth of unsung soul, such longing and such yearning.
Every year I vow to change the world before I die. Every year the world changes, and I didn't even try. Every year since giving birth I vow no longer will I curse. But damn it, I'm a parent.
From all the speeding I do that is not legal, to the sister-in-law I still love to needle, I resolve to be ever so nice and kind. On January 2nd, I changed my mind.
Promised myself I would write this couplet. Sorry to say, it just isn't done yet.
Sure, my 2020 goals are going just fine. I'd get them all done if I could just find the time.
The long walks I promised to my dog. The men at bars I would not snog. Long morning runs in lifting fog. Calorie counting in this food log.
Candidates for office I should uplift with walks and calls and poll place shifts. Grocery shopping with more thrift. The long-lost friends, your misplaced gifts.
Bills, please pay yourself on time. To all of you, I send these rhymes. Worry not, I have a notion. I can fix this with a potion. Gather the coals, the cauldron set. Add in 3 fresh drops of sweat. A chicken egg, not yet hatched. Prescription pills, finally fetched.
Sprig of flowers not yet bloomed. More home cooking fills the room. And lastly here, the secret seed. That dead goldfish I didn't feed. I free you from your frozen disposition, the unclean refrigerator in my kitchen. And one day soon I'll drink this stout after I take my sweet dog out.
An excellent way to start off the first month of this new year. With the new year comes...
All right, so a little bit of fun about all the things we and our family and our friends say we're going to do, as well as some of the things we hear from our clients and our patients. So thinking about behavioral change, which is mostly what I do in life, is work with people around improving their health, their physical health, their emotional health, their mental health, their interpersonal health. So some things that help resolutions stick is that, to keep in mind that the idea of change and the reality of change are not the same. And that often when people are faced with the mundanity of sustaining the change and that it didn't somehow solve all their problems or completely transform their life, they give up. So being more realistic about what change actually does and how much work it requires. Some patients or clients, depending on what setting you're in and what term you use, some patients talk a lot about changing and doing things different, but never quite get started. So helping to problem solve that with them and figure out what gets in the way of them starting. And one strategy I often use is acknowledge previous successes where they've already done things that they're not giving themselves credit for. So as we get closer into February and March, the reality of the year sets in, and the idea of change, that sparkle, that hope for what the future could be, begins to fade, and we settle into status quo, which is the easiest thing for most of us to do. And so we can safeguard resolutions and change plans by adopting a sustainable approach for success. And some recommendations on how to do that are to have SMART goals, which most of you are probably familiar with, are specific, measurable, attainable, realistic, and time limited. So I'm going to lose 50 pounds in 2 weeks, not necessarily, right? But you know, and if they do, that's going to be change that they're going to give right back. Pounds are going to regain, right? So being realistic about what they can do, make it measurable, like I'm just going to be a better person, I'm going to have better relationships. Who knows what that means? Who are successful people that they know? How can they use those as role models? What are habits, successful habits that they've seen in life that are within reach, right? Like I had a patient come into the hospital, oh, I'm going to buy a new Peloton for $5,000 and have it shipped here. And I was like, let's start with just regular walking. Maybe let's look at getting a secondhand exercise bike somewhere, that kind of thing. So just investing a bunch of money may not necessarily bring the success that they think. It is recommended that we do something and give ourselves credit for what we do to be successful every day and having daily rituals. So like a to-do list, I like to think about it as a journey to be on, not a list that we are ever completely done with, and to make sure that we put on there all of the things that we also do every day that are never in question, but we do them anyway. We get out of bed, we take a shower, we eat, we take out the trash, we feed the dogs, whatever it may be. And that, you know, and I sit with patients and I'll say, what have you already done today? What have you already accomplished? And usually within 30 seconds, we can come up with 10 more things that they've already accomplished in their day that they're not giving themselves credit for. And success builds success. Tapping into their encouraging supports, who are their support systems, who are the healthy people in their life that are gonna help them with that, and having an expectation of being successful in a realistic way. All right, so then another thing that we wanna share with you that helps people with change plans and is consistent with lifestyle medicine is there is this website called Change That Matters. It's a University of Massachusetts, I think. Ben, do you know? I'm forgetting what UNM is. Someone probably knows.
Sorry.
They put together a whole, and there's PowerPoints there that clinicians can access that you can use in your psychoeducation groups. And they have these handouts that are great little change plans, little pamphlets that you can do. And you can download them. They currently have them in English and in Spanish. And they're just nice little prescriptions to send home with people. And they're all public domain. So I encourage you to go there and look at that. These are 5 of their 10 topics. All right, so then shifting gears towards our primary topic, which is lifestyle medicine. So Dr. Wing and I are both I'm board certified, and he's on the cusp of being board certified in lifestyle medicine, which is an interprofessional group that includes many physicians, as well as you'll see here in my 3rd bullet point, behavioral health clinicians, health coaches, pharmacists, nutritionists, PT, OT, and many others. This is a national movement as a way to help people be healthier, both physically and emotionally, by using the 6 pillars, which we will tell you about in a couple of slides. And so with lifestyle medicine, we're targeting the chronic diseases like hypertension, diabetes, obesity, and that those are made worse by not having great mental health, having a lot of stress and problems in your life, inadequate activity, too much of a sedentary lifestyle, poor nutrition, smoking, using drugs and alcohol. And so lifestyle medicine seeks to get underneath the chronic health conditions and treat some of the core problems or core causes of that. And it can be embedded in a primary care setting, which is where we're seeing it in many places in the country, where we're having integrated behavioral health specialists working alongside primary care, but many OB practices and other practices are doing this. And then some mental health professionals like myself are now using a lifestyle medicine as an independent practitioner, not on an interprofessional team, but working in collaboration with primary care and other doctors. So lifestyle medicine professionals work on health promotion and lifestyle change to optimize both physical and psychological health.
Yeah, so exactly like what Dr. Moonshine is saying, that's for me as a primary care provider, it's really trying to emphasize those lifestyle modifications as the primary means to managing chronic disease like diabetes, obesity, hypertension. And what really resonated with me as I was learning more about lifestyle medicine is that it's more than just simply saying exercise more or have a better diet. It's really diving into what are some of the more holistic evidence-based methods that we can provide those guidelines to patients. And then on the next slide, we're going to outline essentially what those 6 pillars are that Dr. Moonshine alluded to previously. So those 6 pillars of lifestyle medicine are 6-fold. First, it's talking about diet, it's talking about exercise, it's talking about improving our sleep, it's talking about reducing our stress and avoiding any harmful substances. In particular, it talks about tobacco, and then obviously trying to improve our connections, whether that's with friends, family, or a higher power. And then we have a nice image on the next slide that kind of outlines a lot of these 6 pillars. And this is really where everything within lifestyle medicine builds upon. And so for each different patient, you may have different areas that you try to focus in on. And as with all of us, I think I would venture to say that probably all of my patients, there's one thing that they could benefit from. And even amongst ourselves, you know, as healthcare professionals, I'm sure there's plenty of areas where we ourselves can also improve. One of the things that I found really interesting learning about, or as I was preparing for this particular presentation, is that historically we understand that within healthcare, it was very much an authoritative type of model. And it wasn't until the late 1980s that we shifted and we started to go more towards this shared decision-making model. And what exactly does that look like? Of course, within the primary care setting, I'm helping my patients to manage their chronic disease. And the first line treatment is lifestyle modification. That's the very first thing, which is a kind of a difficult thing in today's world where we're so used to being able to get whatever answers we want. You know, we can quickly Google up an answer of something that we learned a long time ago and get the answer right then and there. And there is that kind of mentality of, oh, well, if there's a pill for that, then great, just give it to me. And so, of course, within lifestyle medicine, it becomes difficult for us as providers because it's really trying to establish a partnership between patient and provider. It's really helping them to facilitate not only realistic goals, as we mentioned earlier, but also helping them to develop meaningful lifestyle modification. At the end of the day, it really is their motivation that's going to push them to keep these changes. Ultimately, yes, it's harder. And you know, when patients do end up making and keeping those changes, it can be more motivating to them. It can be more empowering, and it can be more in line with that shared decision-making model. Interestingly, in my experience, here in our population here in Hilo, lifestyle modification is something that many patients they resonate well with. They want to try and avoid medications as much as possible. And so as a provider, I've found that it helps build that relationship or I guess that partnership, if I introduce myself at the beginning as their new provider, saying that my goal is as much as possible to avoid medications, as much as possible to partner with you in making some of these changes. And so far I found that that's worked really well and resonated well with all of my patients. Lifestyle medicine, of course, within the primary care setting, of course, it's going to be dealing with those chronic diseases, and those big bullet points within lifestyle medicine are going to be the diet and the exercise. Of course, another big proponent within family medicine is that we see a lot of behavioral health. related issues. Oftentimes you can boil them down to problems with their connections with family or friends. You can boil it down to either anxiety or depression, or dealing with stress or difficulties with sleep. And so in that way, lifestyle medicine is very relevant. And then, of course, within family medicine, we care about that future prevention using routine screenings. Part of that process is really helping to reduce substances that are causing harm. And so in that way, lifestyle medicine fits within the primary care setting. Something that I found kind of interesting with this word cloud is that I just searched primary care word cloud, and this was what popped out. And I was surprised by how a lot of the words that were popping out to me were urgency, emergency, accident, all of these higher acuity type of words, when really it should be more of that, more so outpatient stuff. So dealing with lifestyle modification, diet, exercise, those types of things. And so to me, I felt like that was a reminder to myself that I wanted to try and avoid those more high acuity type of words and really just try as much as possible to help people focus in on what are the lifestyle changes that they can do now. This is kind of an interesting side. So during my first year of residency, I did a research project, essentially having patients rate themselves on a scale of looking at, did they feel like it was of value to discuss lifestyle modification? Were they satisfied with how I, as their provider, discussed lifestyle modification, their engagement, their comfort, whether they felt that this regular discussion improved their accountability, and whether they felt like this pattern of setting SMART goals with me as their primary care provider would encourage them to do so in their personal life long term. And you'll see that the biggest section that showed the largest improvement was in accountability. Now, this was a small sample size, only about 50 patients, but they found that it improved their accountability. The other interesting value you'll notice is did the patients find that it was of value to discuss lifestyle modification, and there was an improvement score of 0%. And that's because every single patient rated it a 10 out of 10 for all of their, both the pre and the post survey. Now, ultimately, who does it benefit? Again, I've kind of alluded to this. I really think that it benefits all of us. And it really encourages that maintenance because ultimately, at the end of the day, one of the hardest parts about lifestyle modification is that ongoing maintenance. Interestingly, there was a study within 2000, I think it was 2019. It was by an exercise app called Strava, if those who are familiar with it. It strives to connect you with people of similar interests. So if you're into hiking, it connects you with those groups within your area so that you can hold each other accountable. And they gathered 98 million data points of patients talking about their New Year's resolutions and when they stopped doing it. And they deemed January 19th as the quitter's day. And so it's one of those things where we strive to set these goals. And again, it really highlights that maintenance is really that most difficult point.
And there's also some research support that if we do something for 21 days straight, we're much more likely to sustain it. All right, so lifestyle medicine we can all play a part in this. And so certainly physicians can start the conversation in, working with people around their chronic health conditions, about pervasive pain issues, poor sleep, stress, any of that. So physicians have a role to play in any of their settings that they can talk about the 6 pillars of diet, sleep, exercise, stress management, limited substances, and connections can all be helpful. And then those of us in our different roles. So for the mental health clinicians, both those of us that are working in independent practice, those of us working on an interprofessional team at a treatment agency, we can do some of this lifestyle medicine. Even if you're not formally trained in it, you probably do some of it, and I would encourage you to do more of it. And as Dr. Wing mentioned, this idea of value and accountability, of checking in on it, on asking about it. And so, when I was originally trained as a mental health professional, I dealt mostly with, depression, anxiety. I didn't think about physical health. I didn't ask about how people were sleeping. I didn't ask what people were drinking and eating. I did around substances, but not, how much caffeine do you have? How much sugar are you eating? How much processed food? And now, even in independent practice, I ask about these things in every session, and it makes a difference. And as we know, it's all connected. So I think it's a good idea to ask, how are you sleeping? What can we do to improve sleep? What kind of food are you eating? Can you eat fresher? Those kinds of things. How are you managing your stress? So when I worked in primary care settings, and even now I do this to a certain extent, is, what is going on with people's physical health? What are the recommendations from their physicians? How are they following through with that? I do a lot of health coaching around how can we eat healthier? How can we move more? How can we improve our sleep? And in almost every session, I do this bullet point where I encourage people to take deep breaths, to breathe deeply, and I practice that with them in session. And there's certainly the idea of mindfulness and meditation and those things, and I think they're great. And for some of my clients, that's perfect for them. Others of them, they're never going to do that. That's not their gig. And so I just talk with them about breathing deeply and how that activates the parasympathetic side of their nervous system and moves them away from fight or flight. And I have a little intervention that I do that's about 5 minutes long with that. Drinking more water is always a good idea, eating well, moving regularly. Lifestyle medicine recommends that we don't sit still for too long, that we try to get the best sleep we can get, even with whatever difficulties and challenges we have, that we laugh, that we try to not take ourselves too seriously, that we laugh at the chaos of the world, that we make connections with ourselves, with family, with friends, with pets, and maybe with a higher power if that fits for someone. And then limiting substances. And for me, limiting substances is drugs and alcohol, but also sugar, caffeine, and nicotine. And a primary care psychologist also does a lot of screening for depression, anxiety, and substance use. So, the GAD-7, PHQ-9, the audit forms. In the primary care setting, psychologists and mental health professionals tend to do more short-term solution-focused psychotherapy with an overall focus on improving both physical and emotional health. We use a lot of stages of change and motivational interviewing. We provide education and clarification, and we try to reinforce and stay consistent with and problem solve the messages that the primary care doctors and other doctors are. So right now my office is right next door to an eye clinic, and I have many patients that come from there, and that optometrist is great about recommending more fresh vegetables and dark leafy greens for eye health. And so I have one patient that I had from the clinic that Dr. Wing is at, who came in, who was still seeing me and then goes there for the eye clinic. And he's very worried about losing his sight as he gets older. And it's a single man who has been eating a lot of convenience stored food, which is not great for his Parkinson's or his diabetes or his hypertension. But now the window of motivation has opened that the eye doctor said, your eye health is going to go down if you don't eat more freshly. And so he and I are actively treatment planning that. We're looking up cooking videos. We're connecting him to the senior center. We're talking about how he can get a vegetable box delivered. And so a lot of our work is about him eating healthier and how that helps his health and then ultimately reduces his anxiety. So when I'm working from a lifestyle medicine perspective, I'm thinking about the holistic framework of what is going on with the clients or patient's biological system to the extent that I understand that as a non-medical professional. I also, in my history, ask about how is the health of first-degree family members, both good and not so good. I look at psychological factors, of course, trauma being a driver of a lot of psychological issues, childhood trauma, intergenerational trauma, cultural trauma, current, historic, all of those factors. I look at trauma, assuming everyone has trauma in their own way. And what are their social determinants of health? What is their economic level, their education level? What is their housing like? What are their relationships like, and what impact does that have on their health? And then, lifestyle medicine uses psychological science to promote health, prevent illnesses, and improve. We also work towards systemic improvement of the healthcare system, which, of course, there's lots of great things about it these days, but there's lots of ways that things could still be improved. We look at motivation, and for me, part of helping people be motivated is, what are the barriers to change? What is hard about eating healthy? What is hard about moving more? And how do we problem solve that? And how do we also help people move away from all or nothing perfectionistic thinking that I have to exercise an hour every day, that I have to eat fresh vegetables at every meal, right? Like, that might be a great goal to work towards. Is that ever truly attainable? Probably not. And then I look at patients' health behaviors. What are they doing to be healthy? How can we extend those strengths and those successes and help them understand what choices they're making along the way about how they want to live? And so all of that comes down to exploring factors that allow people to be healthy, recover from an illness, and cope with a chronic condition. And so here are the 5 A's that we use in lifestyle medicine. We use these other places for the change process. And so this is meant to be a pretty brief framework that we could do in a session or two. And sometimes it doesn't even take a full 45 minutes once you're used to it and have some skill with it, because in a primary care setting, or in outreach medicine, we're going to do things much more quickly and not in depth as a long-term therapist might. So we want to assess what are the symptoms that they're having, what's going on with their physical health, their emotions, their thoughts, their behaviors, what are the social determinants of health, right? The risks, the attitudes, what do they want, right? Because the patient's desires and goals are always predominant. And then we're going to do a little bit of advising them, which is not giving advice, but maybe doing some education, maybe making some recommendations, maybe brainstorming some options, looking at what's realistic for them, what are their strengths, how do we leverage them, what are the circumstances the patient is in, how is that helpful or not helpful to the changes that the patient wants or what the primary care might be recommending. And then we want to come to an agreement of what are the next steps? What are we going to work on? How are we going to do that? And that hopefully is primarily patient driven, although sometimes I try to guide it. Sometimes I sort of say, well, that's not exactly what we're thinking about. And then I want to assist them in developing whatever skills they need to implement their plan, problem solve and overcome barriers, and then hopefully arrange for some follow-up, whether that's with me, with their primary care doctor, with community health worker. And ideally that happens in the next 2 to 4 weeks. And when we're in the action stage of change, I like to see people a couple times a month, more often if that works, but that is really helpful. And then going maybe to monthly or bi-monthly once they're in the maintenance stage of change. So this is the second time we're seeing this graphic, and I just really want to drive home the focus of lifestyle medicine. It's about eating healthier. The primary recommendation, oh, actually, we have another slide about that, so I won't say that right now. But, eating healthier, moving more, managing our stress, having healthy relationships, and those relationships can be with us, with our family and friends, with our pets, with nature, and or with a higher power. Any or all of those are good. Sleep, and then substances. And then I think on this slide, we have specific recommendations. We have sort of the gold standard of what lifestyle medicine recommends. And then we have sort of the second order, more realistic, more sort of low hanging fruit. And then in the slide after this, Dr. Wig and I are going to give you examples of how we work with this, with each domain, each pillar with a patient story. So for diet, I'm trying to see this on my screen. What happened? Okay, there we go. So for the diet recommendation from lifestyle medicine, they are grounded in this idea of whole food, plant-based diet, which is fabulous for a lot of people. Many of our folks are not actually interested in that. The ones that are, great, let's work on that. But for folks who don't want to give up eating meat, for folks who can't afford fresh food all of the time, that is not the standard. And so my modification for this is encouraging eating fresher when they can and eating less processed foods. And so I talk with patients about reading food labels, about trying to shop. Here's a little mini intervention that I learned from one of our docs that specialized in culinary medicine because she previously had been a chef, is that getting the majority of your food from the outside area in the grocery store, not in the aisles. The aisles are processed foods. So I talk with people, that you're in the produce section, in the fresh meat section, maybe in the bakery. You shop on the outside area, the perimeter of your grocery store, and get less from the middle of the grocery store, from the aisles. And mostly I encourage people to just eat as fresh as they can and try to have less things in boxes and cans. And I even say fresh meat is reasonable. Try to avoid the processed meats, eat those in small amounts. So bacon, Spam, cured sausage, any of those things. Those might be okay in moderation, but not at every meal if that's possible. So those are a big goal for the diet pillar, and a smaller goal. The big goal for exercise and movement is 150 minutes of moderate exercise a week, or 75 minutes of vigorous exercise. Oops, Ben, is this yours? Sorry.
Oh, no, it's fine. I have examples for any of them. That's fine.
Okay, well, let's go back to diet.
Yeah, so diet, I actually had a really interesting one just the other day where there was a patient who is very, very strongly against starting medications. And this was my first time ever meeting her. She has a BMI of 62. Her diabetes was recently checked with me prior to my visit with her, and it was uncontrolled. The level where she was, truthfully, she would benefit from both the lifestyle modification and diving into the evidence of how much it would be able to affect her A1C, or her diabetes marker that we follow. She probably needed both medications and lifestyle modification for where she is. But she was very, very strongly against starting something. And so we just went with the more lifestyle shared decision-making model, right? Kind of going into that. And when I followed up with her the next time, she had lost 7 pounds, and she was very motivated. And we were able to discuss some of the successes that she had and some of the areas where she wanted to fine tune. And truthfully, 7 pounds is a big deal for someone who's at that level where she started. But even then, it's just, I don't know, being able to see how excited she was to see that she had lost weight, and to see that the choices she had made were making a difference. You can't beat that, really. And so continuing to encourage her on that front. And then of course I'll be seeing her in about a month or two, where we're going to be able to check and see what her latest diabetes marker is, just based on that. Right. So it's always an ongoing process, but really good example. And
diabetes, blood sugar is greatly improved when people lose 5 to 10% of their weight. So a loss of 10 or 15 pounds may make a huge difference in someone's A1C level. In general, we recommend that people lose 1 to 2 pounds a week, not more than that, because it tends not to be sustainable. And in terms of weight loss, diet is the best focus. It's not the easiest focus, but to lose weight, changing the diet and reducing calories is the recommendation. To sustain weight loss, exercise is the primary. So when people intend to eat the same amount but exercise, that's healthy. It may not achieve much weight loss. So the gold standard from lifestyle medicine's perspective of exercise is 150 minutes of moderate exercise a week. That's 30 minutes, 5 times a week, or 75 minutes of vigorous. Not always possible for people to do this. They're not always able to do it for a variety of factors. So at a minimum, we would like people to not sit still as much. And lifestyle medicine encourages people to get up for 2 minutes every 20 minutes. So if they're watching TV, that's a commercial break, or 5 minutes every hour. So if you're streaming, you stop between shows and you get up and you stretch, you walk to the bathroom, you walk around the block, you touch your toes. If you're sitting at your desk at work, if you're seeing patients for 50 minutes, that you get up between every patient and move for a minute or two. Dr. Wayne?
Yeah, so from the physical activity standpoint, I see Renata mentioned the 300 minutes. Yeah, so the physical activity guidelines that we learn about are the 150 minutes minimum for those who are really attempting to maintain steady weight loss. You really aim for more of the 225 to 300 minutes. And that of course, exactly as you said, is going to really depend on the individual. For this particular patient that I just spoke about, I would never say, hey, you need to do 300 minutes off the bat. And so it's just kind of this gradual working them in towards those specific goals for themselves, and ultimately guided by the patient based on their level of motivation, based on what they feel is realistic in their ability to achieve. From a physical activity standpoint, I had a patient who very young, in her 30s, but on dialysis for kidney problems. And she suffered from chronic lower back pain. Because of that, she frequently had refills of oxycodone. And one of my first visits with her, I was able to discuss what her physical activity looked like. And she didn't do much, which understandably, when you're spending a lot of time in a dialysis chair, there's not a whole lot of physical activity that you can do. So we talked about some of the barriers and some of the goals that she could set as far as just lower back strengthening exercises. Because I noticed during that first visit that her posture just wasn't that great. And she started to do some of these physical activities for strengthening both her core and her lower back muscles. And she found that the pain lessened. She's still on oxycodone and we're still trying to actively work on reducing that amount, but just a small thing that we could recommend that I found made a difference for this patient.
For sleep, we really encourage people to really get 6.5 hours or more is better. That's not always possible, right? And quality sleep is important. But if you're sleeping on concrete because you're houseless, that's not helpful. If you have young kids in the home, if you're working multiple jobs, right? But helping people get, optimize the best sleep they can get with whatever reality they have. And sleep is something that we significantly undervalue. And it has a huge impact on our physical and emotional health. Dr. Wing?
Yeah, one particular patient, actually, I've got a few, where it often goes hand in hand with anxiety. That common complaint of when I wake up in the middle of the night, I can't turn my brain off. And so we're able to just talk about various different sleep hygiene methods to try and help them to improve their sleep. And it's always an ongoing process, but there are various different things that I found have worked really well. And one of the ones that I've been playing around recently with is for this type of a patient where they have a hard time turning off their brain, is having a moment to journal. I call it a worry journal, or something to just essentially jot down everything that's on their mind, make it part of that daily sleep routine, to say, hey, I am giving you 3 to 5 minutes to just unload all of the thoughts that are in my head, and then laying that to rest before going to bed. And I found success with some of my patients on that.
Right. I've had many patients that have improved their sleep and it improves their mental health. So it's one of my primary things that I work on. So stress management, most of us work on this in some ways. We want to increase stress management and coping skills. That may be having informal mindfulness practice, formal mindfulness practice, having a gratitude practice of what they can be grateful every day, and then having meaningful life. What does it say after that? Having a meaningful full life. Okay. Dr. Wing.
Nothing really to add on that. I had a patient very similar, but
Okay.
we just changed her focus and she really improved in her ability to deal with the stresses she was
Right.
complaining with.
So this is where I try to teach deep breathing, and people are like, I'm breathing all day long, how's that help? And I talk with them about when we're in our fight or flight mode on the sympathetic side of our nervous system, that the only thing we can control to downregulate our system and change our thinking is our breathing, and that moves us to the parasympathetic. And I have them practice that. And I said, it's not going to solve your problems, but it's going to help you get grounded, and it's going to give you the bandwidth to then work on what's stressing you out. So then connections, that we've mentioned, having connections in some form or fashion. And that can be, whatever the patient defines it. Some people don't have a lot of other people to be in relationship with, but can it be pets, nature, or a higher power? Anything to add, Dr. Wing?
No.
All right, and then the last one is reducing substances. From a moderation management, we're not saying drug and alcohol use is bad, but for some people it may be, and there is some research support. There's research support, this is a glass of wine every day is healthy. There's also research support to say any alcohol is not good for our physical health. Depends on where you fall and who your patients are, but moderation management for sugar, caffeine, nicotine, alcohol, and other drugs. Anything else, Dr. Wing? All right, so then how this fits in terms of, and I don't know if I have time, but I might try and find it if Dr. Wing talks for a minute. I had a slide from another presentation that we did that I just remembered that broke down depression. These are the lifestyle modifications that we would prioritize, and I might try and find that in a minute while you guys are wrapping up. But this is what is called the Mental Health All-Stars. This is a Google image that I use on a handout to really encourage people to take care of themselves and use whichever one of these helps. And when one isn't working, try another. And then this is my final slide. If you want to reach out to me after today, it's my practice website. My email address is here. Don't give that to clients, please. But I have a couple pages on my website about lifestyle medicine. And Dr. Wing and I are also happy to share more resources with you. So I'm going to unshare my screen, and then I can figure out how to do that. And then maybe Dr. Wing, you could do talk, and I'm going to see if I can find, which slide I'm talking about that we had in the motivational.
Yes. Yeah.
I'm going to see if I can find that and share just that one slide. Okay, I'm leaving it in your hands for a minute.
Yeah, of course. So one of the things that I found that was very, I guess, is the biggest stark difference between when I first came into residency. Pardon that. I'm in the hospital right now. When I first came into residency, Dr. Moonshine was present in our clinic as our clinical psychologist. And oftentimes I was able to refer my patients directly to her for some of these discussions and this ongoing, trying to, especially as a primary care provider, only being able to see these patients every, 2 months, 1 month, maybe, but then being able for them to meet. Oh, goodness.
All right, it may not work. You may have to mute yourself. That's a good try. All right, so Dr. Wing and I used to work in the same primary care clinic, and we would work hand in hand, and I would get to see patients every couple weeks, and he would see them every few months, and we would just really use a team approach. So I wanted to share one thing with you real quick, and then we'll just check in to see what is left over. I found another presentation that we had done together that helps us think about these things. So not to go through all of this, but here's some recommendations for lifestyle medicine interventions for anxiety, right? So the first thing we're going to prioritize is stress management, some recommendations about sleep, regular exercise, avoiding caffeine for folks with anxiety is probably helpful. Then I have a slide about what to do with depression. Exercise would be my first priority. That can act as an antidepressant quality. Not everyone wants to do that, but it's something to think about. Then the next thing I think about with depression from an LM perspective is stress, sleep. So I broke down the three big mental health disorders that I work with. So bipolar, consistent sleep is important. Stress management, super helpful. Exercise, right? Not using substances is helpful. So I looked at some specific diagnoses about that. All right, we are right on time. So questions, comments, anything we didn't want to cover, anything that people want to share?
Any questions for Dr. Moonshine or Dr. Wing? Please feel free to unmute yourself or put it in the chat. And if anyone has a case today.
Well, this was a great way to start off the year. That's for sure. Did you guys get all the chat? Sounds like you covered it all.
Yeah, there was a comment about, if patients can do more, any movement is good movement. All movement is helpful. The more they can do, the minute, for maintenance, lifestyle medicine recommends 150. Of course, if people can do 225 to 300 in the midst of losing weight, that's better. That is a standard from other associations, and I agree with that. My patients, they're not doing it. 150 minutes would be hard for them. So, you know what I'm going to do, Summer, because as we started this presentation, I remembered those other 3 slides that Dr. Wing and I had in another version. I'm going to add them to this slide deck and send it to you one more time. So
Sounds
so
good.
it's all there. So if people want to look at the lifestyle medicine recommendations for depression, anxiety, and bipolar, I'll add it to the slide deck and send it to Summer, and it'll be posted on the website.
Thank you.
Excellent. Any other questions, ideas? Lots of thank yous.
So it's great to be with you guys.
Thanks for having us.